May 23rd, 2011 is a day that I will never forget. That day started and ended just as normal as any other day up until about 11:30 p.m. I was awoken by a disturbing phone call from my mother. She was calling to tell me she had cancer. I was in total shock. I could not believe my ears. My mother was so young, so healthy. She seemed just fine. That night was the beginning of a short in duration but treacherous fight for my mother's life. Sadly, her fight ended just 3 months later on August 25th, 2011. Cancer is a horrible disease. It can sneak up on us at any given time when least expected. Today, I would like to share some symptoms, treatment, and prognosis of ovarian cancer with you. I truly believe that knowledge is power. The more we know and the more in tune we are with what's going on inside of our bodies, the better chance we have for winning the battle if we ever come face to face with this nasty disease. Some symptoms of ovarian cancer are abnormal vaginal bleeding. If you experience bleeding that is not regular to your normal menstrual cycle, please do not let this go unattended. Another symptom of ovarian cancer is bloating beneath the stomach. These patients experience a bloat that's constantly causing a pudge underneath their abdomen. It looks like they're a couple months pregnant. The last symptom I'm going to inform you of about ovarian cancer is becoming extremely full while eating. If you have eaten just a little bit of food and you would become extremely full, that is a sign of ovarian cancer. Treatment of ovarian cancer involves surgery, which usually involves a complete hysterectomy. Sometimes the removal of other infected organs will happen as well. After surgery, the patient will undergo chemotherapy. Chemotherapy is a systemic treatment, which means that the therapy can go all throughout the body where the cancer could potentially have spread. Chemotherapy can be administered orally, through an IV, or through a port. This therapy often hits the patient pretty hard. Prognosis of ovarian cancer depends on what stage of cancer the patient is diagnosed with. There are 4 main stages of ovarian cancer: stage 1, stage 2, stage 3, and stage 4. More often than not, ovarian cancer is not detected until stage 3. The American Cancer Society notes that stage 1 ovarian cancer involves one or both ovaries. Stage 2 involves one or both ovaries and has advanced to the fallopian tubes, bladder, sigmoid colon, or rectum. Stage 3 involves one or both ovaries and has advanced past the pelvis to the abdominal cavity or into the lymph nodes. Stage 4 ovarian cancer is the most advanced. It involves one or both ovaries, and the disease has also progressed to either the liver or the lungs. Patients who are diagnosed with stage 1 ovarian cancer have a 5-year survival rate. As the stages of ovarian cancer increase, the survival rate decreases, with stage 4 being terminal. Today, I have shared with you a personal story about the unfortunate delayed discovery of ovarian cancer on my mother. I have also given you some telltale signs to look out for. These symptoms tend to be shrugged off by most people because they mimic other less serious illnesses. I hope that by hearing my speech, women can become more informed and more in tune to their bodies to catch this disease at an early stage to increase their survival rate. Knowledge is power. We should never underestimate the power of being informed. If just one life can be saved by the information that I have presented today, then I have accomplished my goal.